없어요. As of today, the world, well, mostly China, has 20,450 declared cases of coronavirus infections, where the UK's tally currently stands at 3, as yesterday's number of 2 was increased by 1 following the UK flying in infected persons from Wuhan. Though likely there are many more, perhaps a dozen unreported infections in the UK, courtesy of 120,000 Chinese students. Whilst those that say that the coronavirus is overhyped and not that different to the usual winter flu do not understand that the coronavirus death rate at 2.1% is about 200 times as deadly as the usual winter flu. That and 200 times as many people falling seriously ill and thus overwhelming healthcare systems. Meanwhile, back in Wuhan, the 2 hospitals built at record speed are virtually complete as per CCP propaganda to treat those infected with the coronavirus. However, if one actually looks at what's being built, what we see resembles a quarantine prison camp with self-contained cells that include iron bars on windows to prevent escape. For it looks like the infected are going to be locked into 2 patient cells, and likely the only care they will receive is food and water and perhaps anti-fever meds via hatches. So it will be left largely up to the patient's own immune systems to fight the virus rather than health care. Of course, this makes sense, as the primary objective of the Chinese government is to bring the pandemic to a halt by all means, which can only be done if those who are infected are entirely isolated from the rest of the population. Hence the quarantine camp comprising 1,000 cells that could isolate at least 2,000 patients at a time. Thus, the purpose of this facility is to concentrate those ill with the virus from the general population. However, the consequences will be that those who end up in such facilities are likely to have less than a 50% chance of surviving the virus, given that they are likely already gravely ill and in need of dedicated healthcare that they will not receive due to the number of patients and the risk of infecting medical staff. While sitting here several thousand miles away from the epicenter of the outbreak, we may criticize China for such draconian measures, but China is literally fighting for its survival in attempts to prevent the outbreak from running into the tens of millions, so prepared to sacrifice the ill that they don't have the capacity to treat, so as to prevent a far larger number of deaths if they succeed in bringing the pandemic to a halt. Coronavirus pandemic trend forecast. My analysis of 28th of January concluded in forecast expectations for the virus to spread exponentially, first across China, then the rest of the world, to target 1 million infections by the end of February, resulting in 35,000 deaths. The graph illustrates the trend trajectory forecast infections to only really start taking off globally mid-February, when the number of officially declared infections are expected to exceed 100,000 and deaths 2,500. So we are still some 9 or 10 days away from when the coronavirus pandemic really starts to take off globally and starts to overwhelm healthcare systems. That is the real reason why the number of deaths will greatly start to expand. Coronavirus infection spread day 57. Update. The forecast for the number of infections and deaths by the 3rd of February 2020 versus actual. Forecast 17,868 infections, actual 20,650. That's a difference of 15%. Deaths forecast 553, actual 427, so we're running at 77% of forecast. Were the trend to continue into the end of February 2020, then the number of infected would increase to 1.15 million, whilst the number of deaths would fall to 23,896. So the latest data implies a wider spread but a lower mortality rate. However, these are still the very early days of the spread of the coronavirus, especially given that there are large susceptible population groups with poor healthcare infrastructure, such as India, that announced its first infection Friday, where outbreaks could soon overwhelm healthcare systems. Also, that a vaccine is still a good 4 months away, so far too late to have any impact on this pandemic. Meanwhile, this is what China and Asia's infections map currently looks like, which in my opinion grossly underestimates the number of infected, hence why the numbers are increasing exponentially. If I had to guess at a number, then I would say more than 200,000 are infected as of today. Given the continuing spread of the virus in China and the forecast trend trajectories, then the rest of the world is currently still in the calm before the storm stage, with likely several outbreaks that risk overwhelming healthcare systems, as happened in China. And my latest market analysis is on the silver price trend that concludes in a detailed trend forecast for 2020, which has first been made available to patrons who support my work. So for immediate first access to all of my analysis and trend forecasts, then do consider becoming a patron by supporting my work for just $3 per month. And you will also gain access to my recent analysis that includes the gold price trend forecast for 2020, British pound trend forecast for 2020, AI stocks 2019 review and buying levels for Q1 2020, and a general stock market trend forecast outlook for 2020, as well as the following scheduled analysis to follow over the next few weeks. And ensure you subscribe to this YouTube channel for the next video in this series and for detailed trend forecast videos.